awardee that we'd like to recognize is All Walks of Life. And the representative, I believe, is Shani Pendleton, who is their Chief Operating Officer. Is she here today?
She is.
Good.
Shani,
hello there.
tell us a few words of your program. Or
yeah,
Amy.
I'll share a little bit about All Walks of Life. This wonderful organization provides developmentally and culturally appropriate behavioral health care to underserved urban populations in the Baltimore-DC area through holistic, community-oriented approach that enhances individuals' care by engaging their family, support systems, and other community partners in their treatment. In 15 years, they've served more than 13,000 African American and Latino and or Hispanic men, women, and children. And Shani, I have a question. All Walks of Life fosters a village-centered treatment approach. Could you tell us more about how that's carried out in your organization?
Absolutely. Within our organization, the village-centered treatment approach first begins with leadership. Leadership has to ensure that every staff person and every colleague and every partner that comes on board with the agency understands fully what our goal is. And our goal is to ensure that services are accessible, and not just accessible meaning within reach, but accessible meaning things are explained to the community that we serve in a manner where we're able to build trust. And so in order to build trust with the community, as leadership, we have to build trust with those that are going to be providing those direct services. And so we begin there, continually educating each other as well as our staff and any of our partners, from the administrative staff person that first greets clients. They have to remain informed. They have to be understanding of what's needed. So continually monitoring that. And right above my head, a part of our agency's mantra is preservation of self and community. Understanding that if we don't first ensure that we ourselves are balancing things out as far as self-care, healthcare, as well as our own mental wellness and behavioral health needs, then it's no way we can go out into the community and support anyone. So it is definitely organizational out, because we don't want to hamper the progress for anyone else just because we didn't remain engaged and educated. That village-centered treatment approach in action is similar to other wraparound programs, because sometimes that's what question we get asked. What's the delineation between this and any other wraparound? And the delineation is that the cultural competency leads it. Understanding that folks will not hear you if you're not speaking in the voice that they understand. And then leading based on Maslow's hierarchy of needs. So within that village, if we approach a family, if we approach an individual and they haven't been able to eat consistently, then it's our responsibility to ensure that we connect some portion of their service to the village component that would ensure they eat before they can even get to addressing the behavioral health concerns. So that's pretty much it in a nutshell.
Thank you so much. Thank you so much for being here today and for the incredible work that you do. You're one of our local, fairly local organizations, and we're really proud to give you this award.